Welcome to today's webinar, CRM, How to Optimize Your Tech Stack to Attract and Retain Patients. I'm Jane Weber Brubaker, Executive Editor of Plain English Healthcare, and I'll be your moderator for today's panel discussion, sponsored by Lead Squared. Running a successful CRM program takes a well-conceived strategy, well-managed data, and the right technology platform, but it's been a heavy lift for many health systems. In today's session, our panelists will share their organization's CRM strategies and success formulas, and how they're driving growth and staying competitive. So the way it's going to work today is each panelist will give a mini presentation, introduce themselves and their organizations, and share some highlights of their CRM initiatives. After that, we'll have a moderated Q&A, and we'll save the last 10 minutes for audience questions. So if you do have questions for the panelists, you can submit them in the control panel anytime. Today's session is being recorded, and in a couple days, you'll get an email with a link to view the webinar on our website, ehealthcarestrategy.com. And now I'd like to briefly introduce our panelists, and you can read their full bios on our website. Ross Therian is Enterprise Account Executive, Healthcare at Lead Squared. Mike Sonnentag is Senior Service Line Marketing Strategist at Virtua Health. And Seth Kaplan is Director of Marketing and Customer Engagement at Honor Health. So Ross from Lead Squared is going to kick things off for us today. So Ross, please go ahead.
Thank you so much, Jane, and thank you everyone for joining. My name is Ross Therian. I've been fortunate to partner with hospitals and health systems for the past 20 years to drive better outcomes really across the continuum of healthcare IT, whether that be clinical, revenue cycle, sort of the evolution of patient engagement. And more recently, I've become educated on the experience measurement side of things, so that of the intersection between the patient, the consumer, and the workforce. And so it's through that lens that I kind of see things and hope to talk through today. I will say, there's more pressures than ever on health systems and the providers that they employ to drive better outcomes with a workforce that's really as constrained as they've ever been. And so it is in my view that with a growing focus on personalized care and with value-based medicine putting more of an onus on driving those outcomes and patients taking a more active role in their care, that CRMs are sort of the next major system to be widely adopted, much like EHRs and ERPs before them. And so in my perspective, a comprehensive healthcare CRM should extend beyond marketing and into patient experience, into quality. And so I'm excited to go through a few slides here, and then we'll be transitioning to Mike. So next slide, please. I just want to sort of ground us on Lead Squared as a company. I joined Lead Squared in part because of this belief in CRMs, and I like to think of Lead Squared as probably the best CRM company you've never heard of. We have over 2,000 clients globally. And in the US, we have approximately 300 between the two major verticals that we serve, healthcare and higher education. We are a HIPAA compliant CRM that's SOC 2 compliant, global, so we also have GDPR certification. And so, look forward to having further discussions with folks as they're interested in exploring what we can do together. Next slide, please. In terms of Lead Squared, sort of the way I see us in the market, and this is sort of just trying to draw like a comparison with kind of the four most common CRM use cases that we see. So in the top left quadrant, you have a lower specialization, high integration CRM, good platforms, but they've kind of evolved from other industries like a Salesforce, like a Microsoft Dynamics. On the bottom left-hand quadrant, we have a lower specialization, lower integration. This could be groups that are using things like Microsoft Excel to manage their work. And then in the bottom right-hand quadrant, we have high specialization but low integration CRM. So those might be private equity backed that potentially have the chance to be bought and sold, and then you're dealing with new ownership and contacts from the company. So Lead Squared fits firmly in this top right quadrant. We're focused on healthcare. We have high integration with over 100 different partner technologies that we integrate into our platform, and we really lean into the complexity. So Just to say, this is sort of where we see ourselves in the market. We can move on to the next slide, please. And so while I assume most on the line know what a CRM is, I just want to kind of lay out, a CRM is specifically software that helps an organization to manage their interactions with potential and existing customers. And in healthcare, that is a consumer. And when a consumer is actually in a care setting, they become a patient. But what a healthcare CRM should do specifically is drive patient acquisition. And so they should give you more visibility into a patient before they enter into your system and help you to make sure that you do not lose a patient in your network. They should certainly drive patient retention. And I'll talk through ways specifically that CRMs are well tuned to do so. And they should also drive patient experience through a more consistent and personalized engagement strategy from the health system that's serving them. CRMs provide an excellent opportunity to consolidate systems and technology and give you a more holistic view of the data, which can then be used to glean insights and work with your patients to close gaps in care. They should be able to automate tasks, and that's helping to automate the tasks that patients might have do as part of a care plan, but also to help automate tasks of your workforce. So the workforce is more constrained as ever from a time perspective, and so let's leverage technology to help keep them on task and make sure things don't fall through the cracks. Managing cases, common use case within a CRM, certainly save time versus doing manual processes or using multiple systems to manage a patient engagement strategy. And then they should provide insights. And that's insights through dashboards, that's insights through certainly reporting and analytics. And ideally, they should be proactive in serving up those insights, for instance, when you come in the morning. Lastly, I think really a comprehensive healthcare CRM should be able to help you surface and close gaps in care. So for your existing patient population, they should give you insights into the patients that are most in need of care and ideally help move from the surfacing of insights into the action stage where they're actually helping to drive your team's daily workforce efforts, making it very easy to do so, while also then being used to more mass but targeted marketing to those folks that need a particular gap in care closed. And
Ross, you had a poll that you wanted to sort of get an idea.
Yeah. If you don't mind, just very briefly, I would love to see, with the understanding there's approximately 50% of health systems in the US today that have a CRM, so 50% that do not. We just want to pull up a poll here briefly to gauge all of our attendees on the line. Where are you today in your journey with the CRM? If you don't mind selecting yes, no, in the process of choosing one or implementing one, it would just be fascinating to see. And Jane, I'm going to ask for your input when we have, a decent representation.
Yeah, it looks like we do. So we can go ahead and launch the results.
Sure. Great. So 67% today have a CRM, 33% do not, and not uncommon, and to a certain extent what I expected, but I definitely see a CRM becoming all the more important and working as an interconnected part of your larger system ecosystem, including your EHR. So thank you very much. So I want to move into from the what to the why, if we can move on to the next slide, please. So the reality is today, it's certainly been accelerated post-COVID, but patients are no longer entering your doors when they first begin their journey. They're actually arriving through screens. And so just a couple interesting stats, 77% of patients use a search engine to start their journey. 7% of all Google searches are health related. And as you can see, healthcare searches performed every minute. what I want to iterate is there is technology, CRMs, that can help you know when a patient is doing something like clicking a social media ad or using a search engine or interacting with your website. And so a good CRM should be able to recognize that and bring that into a digitized workflow for your team, whether it's marketing, whether it's care management, to then be able to reach out and connect with the patient at the very beginning of their care journey. Next slide, please. So, this is kind of the rise of consumerism, I think, has been something that has been taking place over the course of the last few years. Healthcare, at least from my perspective, being in the industry for so long, has historically been behind other industries in technology, and especially technology that has to do with bringing to this industry some of the quality of life things that patients have, consumers have in other industries. And so the reality is patients have more access to information. There's many different ways that you can communicate with a patient today. They have significantly increased expectations, which actually have a financial impact as well as a outcomes impact on your business as a health system. And so a CRM is really something that can help combat all of these different things, providing a more consistent, highly reliable experience for patients, automating workflows, and giving you more insight into the individual that you're communicating with. Next slide, please. So a little bit of an eye chart, but what I want to communicate is, while you may think of a patient appointment as being a linear experience for a patient, it is anything but. And so, patients are often navigating a very winding path before they get to your office and then thereafter. This is all the more relevant for, value-based care, but anytime you have a chronic care patient, for instance, that has a longitudinal care experience, this is something that is all the more important to make sure, you are staying highly connected throughout this digital journey, which, by the way, is increasingly complex, but also you have less visibility to. But also, if we think bigger picture, not just marketing, but larger patient experience, pretty much every step along this pathway, the patient has the potential to either encounter friction or lose trust or have fear, uncertainty, and doubt. And so, we have different ways and strategies that we can help ensure that we're lessening the impact of those sorts of things. Next slide, please. So very, very briefly, and this is just scratching the surface, but consequences of an unaligned patient journey, of course, increased costs due to inefficient processes, decreased revenue. When we just think of a missed appointment, what is the financial impact of that? But kind of taking the next step, a patient who has a procedure that they do not remember or prepare for also has a much higher financial penalty that the health system ultimately is going to incur. Certainly poor adherence to outcomes and inconsistent follow-up and things of that nature. So again, there are ways that you can leverage technology to surround the patient with things like reminders at the right time, at the right place, at the right mode of their choosing, to make sure that they're more likely to remain adherent to whatever care plan you have them on, and sort of follow that patient throughout the journey. Secondarily, going back to my other comment about having friction and negative experience, these are all things that also impact CAHPS scores and impact star ratings. And so it's a compounding sort of problem that you can solve for. Next slide, please. So this will be my final slide. I just want to go from sort of that long, winding journey to what a holistic CRM platform can do, and that is give you this omni-channel capability to connect with the patient, whether it be through phone, email, text, and have that stored in a single place. Surround the patient with patient-centered processes to help remind them, but also help encourage them or help provide them with education or help make sure that they understood their discharge plans. All of those things can be part of a automated workflow that we sort of co-create together and can give you insights into when the patient is not doing certain things relative to that. We want to integrate and connect your ecosystem together, give you less systems to do more with, and have sort of that more holistic view, automate processes, and then ultimately help provide more continuity of care for the patient, close those gaps in care, and ultimately drive better health outcomes. So that is what I wanted to cover at a high level. Hopefully I didn't go too quickly through that, but I will turn things over to Mike, please.
Thanks so much. Thanks so much. So I am Mike Sonntag. I am a senior service line marketing strategist here at Virtua Health. In that role, I support our advanced transplant and organ health service line, our neurosciences service line, and our orthopedics and spine service line, which I'll be sharing with you today. So next slide, please. When we talk about our CRM from a marketing strategy perspective, what we're looking at is something that's very cyclical. So something that inherently is benefited by the step that comes before it and benefits the step that comes after it. So looking first at our outreach communications, for example, that includes everything from our advertising tactics to our search engine marketing to content creation and to propensity model campaigns, which I'll share an example of in a moment. Each of those are appropriately tagged. They're driven to dedicated landing pages or to our access center, which are also tagged and tracked. And there is an intake system that pulls all of those data points into our CRM ultimately so that we can analyze it, optimize, and improve our efforts. So everything from those tracking points that I mentioned a moment ago to the creation of reporting dashboards, pulling financials, creating those propensity models, audience segmentation, automation, all of those things. And when I think about this strategy, ultimately the benefit that we see from our CRM is that it allows for us to connect folks with what we have to offer that is going to most benefit them and to take the action that we want them to take. And when I think about that, I'm a movie guy, and so my mind immediately goes to a quote from one of my favorite movies, maybe one of yours, and I hear the voice of Marlon Brando telling us to make them an offer they can't refuse, right? And sure, you know, it may be a cheeky quote and whatnot like that, but when I think about this, I think the word that sticks out to me most is they. So who are they, right? When we talk about the consumer and what we want ultimately the CRM to help us to benefit. And so next slide, please. When we think about that question, who are they? There are lots of sources to answer that question. There are our subject matter experts and robust marketing research efforts, and we can use our CRM and our EMR to help us to answer that question as well. Understand who those individuals are, what's important to them, and how to best match what we are able to offer. Next slide, please. And so in thinking about that, I'm going to share with you an example of how we use our CRM to create propensity model campaigns. So what is a propensity model campaign? Well, at its sort of highest level, what we're doing is we're looking at our patient database and identifying those existing Virtua Health patients who may have a propensity or are at greater risk for a particular condition. In this case, using joint as the example, folks that are dealing with joint pain. So someone who may benefit from an evaluation or an appointment with a hip replacement or a knee replacement specialist. And in building that into our CRM, it allows for us to create communications that are highly segmented, that offer them differentiated CTAs based on where they are in the patient path, driving them to dedicated landing pages that's using the language that's appropriate for that audience, and ultimately, again, connecting them to the offer that's most appropriate and most beneficial for where they are in that experience. So what does that look like when we apply it to the system that we looked at a moment ago? Next slide, please. Well, at Virtua, it starts with our EMR, and we work with a vendor partner who, excuse me, using the database in our EMR creates that propensity model and then applies it to our CRM, where we're then able to get those benefits of segmentation and differentiated CTAs and driving those out into the world with those benefits in mind. Those outreach communications are highly targeted, they're highly specific. They drive to those dedicated landing pages, also speaking that same language, and push that with that same intake model in mind into our CRM. So what we're able to do with all of that data, as we went through in our initial slide, analyze through the tracking, through dashboards, and ultimately go through so that this cycle with every rotation benefits itself. And as a result, it makes it that much more efficient, that much more effective with every rotation and optimization. And not only do we see those benefits within this campaign, but we see it within the marketing mix overall. Next slide, please. So looking specifically at our joint replacement campaign, nearly 300 new patient appointments, when we look specifically at new patients, are directly attributable to our propensity model outreach. That makes up 9.5% of total appointment request leads for this campaign. And when we look at the campaign overall, we see a further 17.1% increase in performance year over year. And I point that out to say that not only do these campaigns, as they apply sort of specifically to themselves within that CRM cycle, not only do they benefit in that space, but there's a halo effect of that understanding that the CRM offers us of that audience, of what's impactful to them, the behaviors that we see within that experience, so that you can further optimize other sort of ancillary campaigns. Your SEM campaign, maybe the learning identifies an area of opportunity for a particular keyword or a new ad group or a new call to action, a patient guide, a health risk assessment, an opportunity for a prospective patient to connect with a provider at a different point, perhaps in their care journey. And ultimately, it brings me back to that benefit that I mentioned at the head, that the biggest benefit for the CRM is that it allows for us to connect those individuals with what we have to offer and what's going to most benefit them. And if we build those things with that benefit in mind, if you'll allow me another movie quote, if you build it, they will come. Also, here I am north of Philly, Red October. We're in the postseason for the baseball season, so I really couldn't help myself. And with that, I'll pass it off to Seth.
Well, thank you, Mike, and thanks to all of you for giving me the opportunity to speak to you today about our CRM program. My name is Seth Kaplan. I'm the Director of Marketing at Honor Health. Honor Health is a medium-sized but growing health system in the Phoenix, Arizona area. And in my role, I oversee our service line marketing efforts as well as our digital marketing efforts, and taking a data-driven approach to how we do our marketing, which CRM is central to. So we could go to the next slide. I wanted to start out with this visual because I think it's something that a lot of you on the line will be able to relate to, because marketers today, especially in healthcare, are in a really tough spot. So if you could go to the next animation there. So we have a lot of different constituent groups that we are trying to appease. So whether it's our executive team that is focused on growth and wanting to generate volume and revenue, or our operations team, which sometimes they are struggling to find the supply to meet the demand for what we're generating. So sometimes they're coming to us and saying, stop what you're doing. We don't have enough appointments. We're overwhelmed with the amount of volume that you're driving. And then the patients, I think that they just want to have an easy healthcare experience, and if we're telling them that we want them to go in to see their doctor, they want those appointments to be easy to find and they want them to be available. And so I think that we're, as marketers, stuck in the middle of all this, trying to appease all of these different constituent groups. So we're going to go to the next slide. And that's where CRM at Honor Health has become really essential, because on one side, we're trying to address everybody's healthcare needs and what they want. On the other side, we're trying to deliver a good customer experience without overwhelming our staff. And we're able to kind of meet in the middle by using CRM to control the flow of communications and lead management that we're generating to the system. So if we could go to the next slide. And this is just kind of an example of how we do this. This is not real data, but put it in here for demonstrative purposes, because we do have an actual report that we're able to pull from our CRM that provides similar data to this. But we're able to look at the different specialties that we have, where the budgeted volume for those specialties was, where the actual volume is, and then where we have gaps in our system for where we have more availability. We're also looking at the average days to the next patient appointment for each of our specialties, because if we're going to market a service, we want to make sure that we can get patients in quickly and easily. And so in this system, in this example here, you can see that in cardiology, we have a gap in the volume that we had projected for the year. We're also able to get in patients quickly. So it's a good service line for us to target for a CRM campaign. So if we could go to the next slide. And we're doing that similar to what Mike just talked about. We're doing that by using propensity-driven campaigns. So we're looking at the demographic factors and the sequencing of appointments leading up to particular targeted service types to find the right target audience for the service that we're targeting. So if we could go to the next slide. So going back to our example of cardiology, we're working with our clinical staff to identify specific diagnoses or specific visit types within our system that where we want to drive that volume. And then we're going back into our CRM system, which is connected with our EMR, to find out what are the demographic features and the sequencing of appointments leading up to that specific diagnosis. So we're able to find people who are at a high propensity to utilize very specific services within the next 3 to 6 months, and build audiences and send out communications that way. So we could go to the next slide. And this is a little bit of how it works in practice. So we're partnering with the ops team, looking at that report that I just showed to identify the areas where we need volume. And then we're using our CRM to find the ideal patients for that service. Then we're making an offer. So in this case, it was a Heart Month webinar where we had a panel of our cardiology experts that we invited patients to come to that webinar to hear from our cardiology experts. And then we're looking at the CRM again to see if they accept that offer. So we have all the registrations tied to our CRM as well. So if they do, then they attend the webinar, and then we send them a follow-up email after the webinar linking to our schedule an appointment page. If they don't accept the offer, we still want to communicate with them, because we know that this audience is really likely to use heart care services. So maybe we just need to send them a softer CTA. So in this case, we sent them a heart-themed newsletter. That newsletter still had a link to the webinar, so people could still sign up for the webinar. But we also included a link to the appointment scheduling page as well, so they could schedule an appointment right from that newsletter as well. So this is just one example. I think like Mike said, there are tons of applications for how we can and do use CRM at Honor Health, but this is just one way that we have done it in the recent past. So that's all I have to share with you. Maybe Jane, I'll throw it back to you.
Okay, great. Thank you so much. That was a great overview from Ross and a virtuous cycle from Mike. No pun intended, pun intended. And we had a supply and demand issue that was kind of resolved through the Honor Health example. So Ryan, if you want to go ahead and close the slides. Okay, or not. All right, so why don't we, there we go. Okay, now we can see our faces. Let's just jump into some of the questions we have for you. Just out of curiosity, how long, Mike and Seth, have you been running your CRM programs? Because it sounds like you're pretty sophisticated and pretty far along in being able to sort of act on these opportunities. So have you been doing it for a while? I mean, a couple of years, 5 years, more?
Yeah, we've been doing, I think we had our first CRM about 7 years ago is when we implemented it. We've actually been on multiple different CRMs in that time. So the more recently we moved to Salesforce, which we've been on for about 1.5 years now.
Okay. And how about you?
Yeah, and here at Virtua, we've been on our CRM since I joined in late 2021, but before then, I believe it was implemented, I think, within 5 or 6 years. It's been.
Right. Okay. So you have some depth of experience, which is great. So let's just kind of get some general sense of where are you seeing? I know you gave some examples, but where are you seeing the most success? And certainly, Ross, you can chime in and talk about some of the successes your clients have seen through Lead Squared. But where are you seeing the greatest success with this? Is it all about service line? Is it we're talking about the ERM? Is it helpful for patient acquisition as well? You tell me.
Yeah, we've been primarily focused on marketing to our current patients using CRM. So using those propensity models to identify the audiences that are most likely to use specific specialty services. For patient acquisition, we haven't used it quite as much. I mean, really because we have so much rich data on our existing customer base through the EMR, it's easier for us to run those propensity models with our existing patient base. Not to say that we haven't done it for acquisition, but it's primarily for our existing patients.
Right.
Yeah, I would say that our balance is similar to that. One of the particular benefits, though, to those propensity model campaigns beyond the example that I shared a moment ago is in identifying particularly challenging patient types. So, for example, as part of support for our transplant and organ health service line, it can be very difficult to communicate directly to the relevant people with chronic kidney disease, for example. The 90% of individuals with CKD don't know that they have it, so they don't know that there's even something to discuss. So this has been a particularly beneficial outreach tool in raising that sort of discussion to even give folks an opportunity to think about their kidney in a sense where they may otherwise not have, and prompt them to schedule their annual appointment, for example, and get that blood test and understand what their kidney function level is. A number of different risk factors are associated with that. Things that are broad, like hypertension and diabetes and things, and we can use the CRM to dig deeper into that data and identify these folks that are at risk.
So Russ, in your experience with your clients, are they mainly using it to sort of like figure out how to leverage their EMR data or find new patients, or both?
So I think the EMR data is a critical piece of the puzzle. So we definitely need to be integrated with an EHR to have that sort of broad view of your patient population. From my perspective, the use cases that we're looking to solve for vary tremendously based on the specialty, based on the makeup of the organization, whether it's a hospital or health system, or could be somebody using a CRM to manage clinical trials, for example. So use cases are very, very different, and you know, a good platform has the ability to sort of meet a health system or a client or a practice where they are, and then typically, you know, you start to realize there's other, you know, economies of scale, things that you can be doing within the system that you might be doing elsewhere. So, you know, it's that visibility to what the patient's doing externally before they come into the office, I think is pretty important. And then, you know, when you have risk modeling and you can actually pinpoint those patients that are either the highest cost or those that you think might have multiple comorbidities and you need to engage them more directly. And I just think there's like far-reaching benefits that can really expand well beyond what we think of as marketing CRM type activities.
Is that sort of more in the context of value-based care, where you're trying to, you know, people?
Yeah, I mean, that's a major piece of it. Yeah, it's a major piece of it. I mean, certainly being able to control costs and identify, you know, who is driving more cost is important, and then just in general closing those gaps in care so that, you know, your sickest patients are being seen proactively versus reactively.
Okay. So I know it sounds like, you know, you've had some, you know, changes in your tech stack. Is this, you know, part of this thing is just to organize your tech stack. And I know you're not like your marketers, you're not necessarily IT people, but, you know, how have you, you know, have adapted that over time? Or, you know, maybe Russ, you can, you know, talk about how people are trying to figure out how to integrate things and maybe streamline the issues that they have.
Yeah, so I would say, you know, I spent almost 20 years with one of the bigger healthcare IT companies out there. And so, you know, I was always amazed, I guess, for lack of a better term, when you would speak to an IT department, how many systems that they're actually trying to support. And it's 100 or in the hundreds. And so the reality is, you know, the workforce is extremely constrained. There's a ton of complexity. You think about system upgrades and the impact that they can have downstream. So generally speaking, like a guiding principle is anytime you can consolidate and reduce complexity and kind of have a more holistic view of things by leveraging systems that allow you to consolidate, I think is all the more important.
Okay. So in the process of doing your programs, I mean, it sounds like, you know, you had unique problems, Seth and Mike, in terms of overcoming, you know, some obstacles, you know, maybe getting to the point where you were able to do what you were able to do. So what were the key issues that you had to overcome? Or did you just come into a system that was up and running and you just kind of jumped up and used your strategic brains?
I wish it were that easy. I think for us, it's been a lot of collaboration with the ops and IT and other teams around the organization. I think that in the past, we did try and kind of bulldoze our way through, like we have this marketing thing that we want to do, and we would just do it, and that didn't work as well. But as we've worked very closely with our service line leaders to identify the real issues that they're having with volumes or where they're having too much volume, I think that that's been key for us, and really just getting them excited about the capabilities that we have. I think that a lot of them, when we start talking about the propensity models and being able to do the targeted marketing that we're able to do, they're really interested and excited about working with us on those.
So
yeah, I would share that that sentiment also, the importance of coordination and collaboration across the operations team, across IT, across excuse me, certainly other aspects of the marketing team. We are you know, highly specialized in and have identified folks that this is their focus, is making sure that, you know, we're identifying these opportunities and are able to leverage them, because to the point that you made a moment ago, there are a lot of different ways to use CRM to solve very different problems. And thankfully, we've spent a lot of time building the infrastructure to be able to do that.
So Seth, I think you mentioned that you had gone through several CRMs. So without mentioning any names, can you just kind of talk about like what were the issues that you had to solve to be able to kind of say this isn't working, now we're going to have to do this instead because we need X? I mean, what were the things that the decision points?
Yeah, so I think that speaking to what Ross spoke about a minute ago is that I think there's a lot of systems out there that kind of call themselves a CRM, but they have, just portions of a true full CRM. And so what we were looking to do is consolidate a lot of the functions into one system. So lead management was really important to us. So to have a system where we could create a lead queue and have our call center or the clinic staff be able to go in and just work that queue very easily. We wanted email capabilities, kind of integrated email and SMS capabilities, so outbound communication capabilities built in or at least integrated with it. I think just finding a system that kind of ticked all the boxes for us is really what we were looking for, and I think that we kind of had various systems that did various parts of that, but we're looking to consolidate everything.
Okay, so Mike, in your situation, or actually, either one of you can answer. How do you establish priorities? How do you decide what to focus on? Is the CRM kind of informing that? I mean, does it surface new opportunities, or does it sort of give you more opportunities just to sort of dig around and try to identify new opportunities?
Yeah, I'd say you answered your own question. I would agree. I would say exactly that the wealth of information and the different opportunities that we have to take a look at the data, dig very deeply into our dashboards and look at the performance, and again, going back to that optimization cycle of seeing what's working, where we see opportunities for improvement, what segments maybe there are greater opportunities, and things like that. That has been our sort of guiding light in driving where we have increases and optimizations. Another area would be added functionality and coordinating really closely with vendor partners that help us to get that much more out of the CRM as a software, and build it into that CRM strategy so that we are segmenting in a highly efficient way, and that we're targeting in a highly efficient way, and that we're delivering the right sort of tactic and message and call to action to the right person. So I would say, yeah, just like the data informs how well an execution, a campaign may have done, it also helps to point out those areas of opportunity, and then that guides our next step.
So so the data, it's all about the data. Ross, can you just talk about, I mean, for the vendor engagements, things can go right or things can go wrong. How do client organizations set themselves up to succeed in an engagement of a CRM implementation?
Yeah, just a few things come to mind is, ideally seek a partner who wants to understand sort of the short-term goals of what you're trying to accomplish, while also wanting to understand your larger strategic roadmap. I would say transparency on both sides is critically important to make sure you have a mutual understanding. Ideally, come up with success metrics and outcome criteria at the beginning of the project. So how can you measure a successful project if you haven't understood what success looks like to begin with? And then identify executive sponsors, and then as much as you can, maybe minimize scope creep, just because that can oftentimes turn a fairly straightforward project into anything but.
Okay. And I've been in those nightmare situations a long time ago. So what is on the roadmap for Mike and Seth? What are you hoping to do in the future? What are the new initiatives that you're going after?
I think like our big picture, big, hairy, audacious goal would be really to have CRM be the center of the patient experience at Honor Health. So more than just, right now we have marketing and the call center and a few clinics around the organization using CRM to manage leads and things like that. I think that we would love to see that expand to others in the organization, even for things like care management. I think we have some capabilities to be able to identify folks that may be at risk for certain things clinically, and it would be great if we could get to a place with our clinicians that even they may be using CRM to manage some of their patient relationships too. So I think that's our big picture, kind of directionally where we want to go. Yeah.
So more spreading out to the enterprise and not just marketing.
Yeah, exactly.
How about you, Mike?
Yeah, we are also moving in a similar direction and leveraging these tools to benefit folks clinically. So, for example, using the system to identify folks that have diabetes who may need a retinopathy scan, for example, or are late for an annual appointment, or a variety of those sort of health maintenance topics that are flagged that are really important to our primary care docs and to those providers that they would refer on to in the relative specialties, and then also expanding out programmatically within each of the service lines that are already using the CRM. So for example, excuse me, I shared that propensity model campaign for joint replacement, but we've also launched 2 brand new campaigns focused on hand and wrist chronic pain, knowing that colloquially, chronic hand pain can be referred to as as carpal tunnel syndrome, in the same way that folks that might get headaches on a regular basis may say that they have a migraine, but they might not. They may not have ever seen a specialist. And so identifying folks with those relevant ICD-10s or DRG codes, but have not seen a specialist for a proper evaluation, reaching out to those folks and making sure that they come in and get that evaluation and push them another step closer to whatever care they need.
I'm not going to get into AI, but it sounds like there's a little AI behind that, helping pull that stuff. So why don't we all three, if you could just kind of talk about what's your, and this will be the last question before we switch over to the audience Q&A. We do have some questions. What's your best advice for other marketing leaders in approaching their CRM strategies, or picking one, or what's your best guidance? However you want to look at it. Ross,
I guess I can go first. Oh, Ross, yes, please.
No, you might.
Well, I guess I would go back to that sort of benefit statement, that because there are so many different and unique problems that you can use to solve CRM, the benefit of it ultimately is connecting those prospective patients with the offer that's going to most benefit them, and allowing that to so sort of the insight in that space to guide your hand at how you use the CRM and when and where. I think best positions these kinds of campaigns and this kind of strategy for success.
Okay, Ross.
Yeah, I would say the major thing is don't just limit it to a marketing solution. I think it has far-ranging benefits, and not to mention if you can bring in quality folk and bring in operations and potentially leverage, other budgets, it's also an easier project as a marketing person for you to kind of manage through your internal process.
Okay, Seth?
Yeah, I would echo what Ross just said, is the collaboration with other departments is really key to having a successful CRM program, because it really does go beyond marketing. And in order to be successful, I think that you really need that collaboration across the organization. I would also say, if you're just starting out, to really try and map out what it is that you want to accomplish year 1, year 5, and kind of have that roadmap. I think you need to kind of take a crawl, walk, run mentality. If you try and do too much all at once, then that is difficult. But if you really map that out and what you want to accomplish in phases, I think that's helpful.
Okay. All right, that's good advice, good input. So I'll just read out the questions. And so the first one is about how many patient journeys are predictable to follow a prescribed path. I don't think you can give an answer to that, but I think what this question is getting at, what about emergent and urgent situations? That there's situations where there is a care path that you're really kind of zeroing in on, where you can lead people to the right care. You want to comment on that? I mean, the propensity model is really predicting, specific things, and I'll leave it at that. I'll let you guys pick it up.
Yeah, we do have propensity models for more emergent things. We don't use them quite as much, but you can sometimes predict, based on lifestyle, behavioral things that, people that are more likely to need emergent care. And then the strategy is a bit different. It's not like a call to action where you say come schedule an appointment. It's more we have emergency or urgent care services, and just creating that awareness for it. Again, we don't use those quite as much with the propensity models. We tend to take a more search-based strategy for those. So, emergency services or urgent care services near me, and trying to capture those searches via paid search or organically. But yeah, that's kind of how we approach it.
Okay. So the question is, we had heard that a propensity campaign targeting select patient populations based on condition is a problem for HIPAA. So what about privacy? How are you handling the increasingly scrutinized issues with privacy when you're targeting people within your patient population?
So I can provide some insight on that. So, excuse me, in terms of the HIPAA compliance and how that data is stored and all that sort of thing, those are all pieces that our IT team and our production team take very seriously and have taken the appropriate steps to keep secure. And then in terms of the communications themselves, there are rules around how those should be written so that they are HIPAA compliant as well, so that someone reading a communication wouldn't immediately know that the recipient of that communication has a certain condition or is at particular risk for this, that, the other thing. It's written in a way that is broadly applicable and generic, if that makes sense.
Okay. Yeah. Do you have to run it by your compliance department?
We work hand in glove.
Yeah. Okay. Let's see. I'm sorry. What if you work in pediatric healthcare where propensity modeling is not a thing, and you also cannot integrate EMR data at the moment? So this person has a wish list, and do you have any response for any guidance for them, any advice for them?
from my
Let's
perspective.
say outside the, please continue.
Yeah, no, just to say, like, from my perspective, there's still certainly ways that you can leverage the CRM to do things like market new services and then do some other things like create fairly rich workflows where you can serve up intake forms and things of that nature. So there's still quite a bit that you can do even with that sort of a patient mix, patient population, and maybe it's their caregivers that are actually doing some of the actions. But go ahead, Mike. Sorry to cut you off.
Yeah, to that point, beyond the scope of the benefits of propensity model campaigns with the CRM specifically, the tool and the insight that it gives you in terms of performance for your marketing mix has a benefit of its own. So everything that it's connected to, your ads out in market, your search engine marketing campaign, your content that is on the website or dedicated landing pages as folks are driving there and interacting with what you have to offer. There's all insight to glean from that and make those campaigns stronger.
So it's really like a business analytics tool in addition to being doing the propensity modeling. Okay. How many CRM campaigns do you typically have in market at a time? Let me get the rest of that. And do you manage them in-house or does your vendor manage them for you? Are these evergreen campaigns or are they one-off campaigns? So who wants to take that?
We have kind of all of the above. So, we manage them primarily in-house. We can run multiple at a time. We typically try and just manage. We don't want to have multiple campaigns with very similar audiences at the same time. But we can handle multiple at a time. Some of them are evergreen. Some of them are more just a one-off or kind of a single drip campaign. So we kind of do a little bit of everything.
Mike?
Yeah, Virtua has a similar mix.
Okay. All right. Another privacy question. How difficult is it to get the privacy? Was it difficult to get support from privacy teams for some of the healthcare issue identifying? Probably the kidney example would be a good one. In other words, did you have any challenges from your privacy team who said you can't do that?
In that particular case, we didn't, but I believe that's because we had sort of infrastructure in place to run those through ahead of time. So, for example, when an opportunity comes up, those individuals are at the table, where there would be an opportunity to flag it if there are any concerns. There are very strict guidelines that we follow, and then of course those sort of behind the scenes production folks make sure that everything is compliant.
Okay.
Yeah, I'd agree. I think that we worked very closely with our privacy team as we were setting up the CRM, and so that they're very aware of what we're doing and are comfortable with it. If they're ever not comfortable with it, then we have a good relationship with them where they'll let us know, or if we ever have questions, we have a good relationship where we can run things by them. Sometimes they'll come back with, we don't want you to do this, but you can do X instead. But I think a lot of it just has to building those relationships with your privacy team is key to this.
Collaboration seems to be a recurring theme here. Another part of that question, this is the same person asking a sub question. You're not getting explicit opt-ins for patient authorization. Is the question. It has a question mark at the end. Correct? You're not getting explicit opt-ins for patient authorization? Do you know, does that make sense to you?
Yeah, so they're it's not an explicit opt-in. So they're I think in the paperwork that they sign when they become a patient, there is a implicit opt-in for us to market to them, and then every communication has an opt-out in it.
Okay. And then there's a last question. I think, Mike, you were the one who mentioned ICD-10 codes. So this person wants to know who's giving you ICD-10 codes. Where do those come from? Because apparently she's having trouble getting codes from various sources.
So those codes, when we're building those models and optimizing the models as well with exclusions and things of that nature, those all come from our operations colleagues. We work very, very closely with them, not just to make sure that we're, identifying and targeting the right folks, but also similar to Seth's example, to make sure that when we are scheduling these outreaches, things that may be evergreen or seasonal or what have you, those outreaches are in line with the types of patients that they have capacity for example, or if there is a new provider being onboarded who needs particular volume, the types of patients that individual sees, we may qualify for that and that sort of thing. So those all come from our operations colleagues.
So the key to that is to make friends with your ops folks, right?
Yes. Yes.
Good. Okay. All right. Well, it's a little bit after the hour, so we're gonna call it quits now. But I'd like to thank Ross and Mike and Seth for an excellent presentation and discussion, and thank you Lead Squared for sponsoring today's webinar. Just a reminder to keep an eye out for an email. In a couple days, you'll get a link to view the recording on our website. And just a couple of announcements before we go. We hope that you can join us for the eHealthcare Leadership Awards ceremony at HCIC. It's in Austin this year from November 10th to the 13th. Not the awards, but HCIC. The conference kicks off with a pre-award ceremony, cocktail party, and networking reception. So if you haven't already registered, you can go to hcic.net and register. And our next webinar will be right before HCIC on Wednesday the 6th, How to Build Your Healthcare Consumer Experience Roadmap for 2025 and Beyond. And we'll have folks from BJC Healthcare, Vanderbilt University Medical Center, and Priya Health. So thank you for attending today's webinar, and we hope you enjoy the rest of your day.